There was this particular weekend, I met a young woman who I brought home. And after 5 days, she called me and she told me that I'm going to die. You've got AIDS, you got it from me. I stood still next to the public phone. I couldn't say a word. And as I was listening, I could hear other people laughing at the end of the other phone. She had hung up, so I dropped the phone. I didn't know where to go. Days passed, every week I kept thinking of death because at that time HIV in Swaziland was rarely spoken about. Messages around those days is like dreams, just throw them out of the window. Having a baby or whatever, forget about them. I started to develop a headache that was attacking me in the middle of the night. The attack came twice. Then the third day, I thought to myself, I was approaching the stage of death, the stage of AIDS. So I concluded if AIDS is going to kill me this way, I couldn't imagine my family suffering with me through that process. I felt ashamed. So the only way out was death, just to commit suicide. I wrote 2 letters that day. One I was saying, I'm sorry to have brought this shame to the family, to my mother specifically, that after what she has done for us, this is how I just say thank you. So I waited for the night to come so that the headache would attack. I had prepared everything, what I would use for committing suicide. I just fell asleep, only to be raised by the sun rays through my window. So I was like, what happened? I slept this night without a headache. I had felt that probably the headache was still coming. So I kept waiting for the headache, nothing came. For a while, I was able to live comfortably with my secret. And then things turned around. I met a pastor in my church whom I disclosed to. And the pastor asked me something that I had never considered. Have you done the HIV test? I said, no.
We've had a lot of people that are really, really scared of doing an HIV test. They would really, really not want to be identified as HIV positive because there is some stigma attached to it. Most HIV positive people feel like they're stigmatized in such a way that people will look at you and think you've got bad morals. Even self-stigma has been seen. Not that they will be discriminated by the other people, public, but they feel like they will be discriminated because they're HIV positive.
I went to this particular clinic, which was the Salvation Army in Mbabane. It took about 3 weeks for us to get our results back. During that time, sometimes I'll wake up thinking this is not true, but some days I'll wake up and think, this is reality, I'm going to die. That process was some kind of a torture in itself, dragging for a long time, not knowing which side are you actually in. So the day came for my results. I went straight to the Salvation Army, where the counselor broke the news for me that it's confirmed I'm HIV positive. From there, that facility became my second home. It was the place where I could talk about fear, hope, all emotions were addressed in that little room. They started to ask me if I would be willing to meet another person in the same condition as myself, and I said, yes, great. That was the first support group.
My name is Sibonginkhosi Mawela. I'm HIV negative. I'm doing a voluntary work at Amical in Manzini. I'm a youth. I help the youth to learn more about HIV and AIDS. My friend motivated me to join the youth program in Amical. He has HIV and AIDS. He was so ashamed of himself because he started sleeping with girls in a younger age and didn't use a condom. He was not feeling very well about telling everyone that he has HIV. So I helped him by taking care of him, going with him to the hospital to get the tablet. I may sometimes take the tablet so that they may think it is me who is having HIV and AIDS.
I thought probably I was the only one in Swaziland living with HIV. There were others in the same situation, and there were people talking like me. Some of them had more hope. Some of them, they had gone through all the symptoms and all the emotions that I was still going through at that particular time. And it provided a space for me to cope better. We realized that we could have other people in the same situation. How do we reach out to those people?
I started dancing when I was young. I joined so many competitions and I was winning them. When I got on stage, people were happy about what I was doing, but I wanted to do more. I love teaching people, teaching them how to dance. I may speak out. After dancing, maybe I can speak out. I joined Luvati, which is in a youth organization, which is giving out a voice for the youth. Then I got a certificate whereby I could be able to teach about HIV, to mobilize people, going to schools and going to my community, making songs so that they can dance and then teach other youth. I'm in a group of youth who teaches most about condomizing and who gives people condoms so that they may use them. We mostly go to the events like bushfire. We were there. We give away condoms and we made them see condoms as a beautiful thing, not as a bad thing, not being ashamed of going with it.
So we were still a closed group, a group where we didn't want to be known because of the stigma. At that time, we didn't have even the guts to disclose. Then we were introduced to this conference, which was in Cape Town. When I flew to Cape Town, I was actually dead, psychologically, emotionally, and otherwise. The only motivator I had was, at least before I die, I would have experienced flying on a plane. I attended one of the sessions during that week on advocacy. This presentation made me feel so guilty that here I am, selfish, thinking about myself, thinking about dying, death, dying, death, dying. Yet, in this space of time that is left, which I didn't even know how much, I could do so much. Beautiful, isn't it? There was fire within me that was burning to do something. I was ready to do a lot. I was ready to change and be mindful that whatever step I take towards disclosure is going to impact those closest to me. I needed to tell my mom. She was the major person to set my whole life free. I tried, I could not face my mom. So I relayed to my sister. She was so positive and so supportive. I'm still your sister and you are my brother. But there was still that gap I hadn't closed, my mom. And I say, my mom is so excited today, so I don't want to spoil her day. Sometimes my mom is already emotionally drained, so I will like, oh, I shouldn't be the one adding. So I'll find another time. Another time never came. My sister, noticing this, told me, I've already told mom. As I entered the house, my mom went straight to me and reached out to me with a hug. Wow. I had not had that experience with my mom before. It was talking 1,000 words. I am this close. I went public in 1996, September. I became the second person in Swaziland to disclose his HIV status. My whole story was put on the newspapers. I was expecting the worst. What are people going to say? Have I done the right thing? Then I went on that bus and one lady just pat my shoulder and said, well done. When we got to know about our HIV status, there was no hope they could give to us. We heard about medications that could sustain people living with HIV for longer years. To us, that was just a wishful thinking, a dream.
Before we started in giving out ARVs for free, most people could not afford buying ARVs, so they'll probably get sick and die. If you're working in a medical ward, you know that you lose more than 80% of your patients because they are immunosuppressed and you're not helping them in any way. So it was like hospitals, we were taking people in for terminal care, especially those that were HIV positive, but they probably would not survive.
We had treatment available in Swaziland in 2003. There was a hope that ARVs were going to kill the stigma because people now have a reason why they want to live. Instead, HIV stigma became worse. As people got to become healthier, they saw no reason of disclosing their HIV status. People continued to get infected. We kept seeing numbers growing yearly by yearly by yearly. We were failing as a country in terms of prevention.
Ever since the introduction of ARVs, we saw a lot of improvement in terms of reduction in mortality, basically meaning we lose less people than we used to lose previously when we were initiating at advanced stages of the disease. We managed to almost hit our targets of about at least 70% uptake or coverage at some point. Ideally, at this point in time, we probably wish to enroll everyone into treatment, onto ARVs, but because of funding and limitations, we probably cannot.
SASO means the Swaziland AIDS Support Organization. Our movement was basically trying to kill the stigma by allowing people, encouraging people to disclose their situation. SASO's basic activities were around sensitizing, creating awareness, the beauty of knowing your HIV status, and creating the environment for people who have become positive so that they have a society, a community that is acceptable to them. We want to believe, as we sit back, we have done so much for the country. Now people are able to associate themselves with people with HIV. But the environment is yet not conducive for people to strive. We have done our part. So it is up to young people to stand up.
I feel so empowered. It's so important for me to talk to the youth because I'm a youth too. I feel like they will listen to me more than they will listen to the other person, and they will, if they see me doing the thing, they will be more advised to do the thing. Yes. Some people don't see voluntary work as a good thing. They think I'm wasting my time doing voluntary work. But some think that it is a good thing to volunteer. Reason being, I got more experience. Most of my friends I hang out with, they are at varsity, whereby I'm not at varsity. So it's like they will get a job, a better job, in the next future, whereby I won't.
Prevalence is basically out of a population or sample, how many people are HIV positive. Currently, our prevalence is at around 31%, 1 every 3 people that you see that are sexually active. When you are treating a disease, less people are dying, more are living with the disease. You expect the prevalence to go up anyway. Because if you want the prevalence to go down, you probably were saying you want those people to die. What we are really trying to reduce, or wish to reduce, is the incidence. The incidence is the number of new cases per year. Between 18,000 and 20,000 people are still infected every year. We get a lot of new infections, especially among the young age group, especially among young women. The incidence is so high between the ages of from 15 to about 24. We are not winning because the number keeps increasing. The community will have to assist us by reducing stigma in some way or the other and making it so acceptable to be HIV positive, and so that people could freely test. And those that are HIV positive enroll on treatment, I think will have a greater impact in terms of reducing incidence, which is something that we desperately need to do.
My family supported me. My friends, some of my friends supported me, although my mother is supporting me in everything that I do. I really love doing what I'm doing right now. My passion pushed me to go out there and teach. I will continue being a voluntary and working for Amical and other organizations. Maybe I will a scholarship so that I can learn more about maybe rural development, HIV and AIDS.
We met on 2011. I used to hear him teaching about HIV, maybe on the radios, on TV. I accepted him the way he was HIV positive. He gave me hope, and the entire nation hope that we can still live as people with HIV. The first time I saw my daughter, I was very excited.
We have tested her twice. She's HIV negative. It's so beautiful. The feeling that I missed for my entire youth. Yeah, my baby's alive. To some degree, I believe I have accomplished what I came out public for.